A very special namaskar and salam dosto. You are watching West Indian Today with yours truly, your host and host Imran Ahmad. I want to say thank you, friends, for tuning into today's program. As always, it's a delight, it's an honor and a privilege coming into your homes, into your television sets, and also into your hearts as well. And it's indeed an honor to be a part of your day and also your lives as well. Friends, today we are going to be talking about a very special organization that has actually made tremendous strides all over in many countries, in over 20 countries. And they're actually, this is something that is benefiting people in many rural countries that may not have actually basically been exposed to radiology, how radiology is actually making a difference for countries in places such as Guyana, such as India, and also parts of Africa as well. And that is actually RAD. RAD, which was founded in 2008 and was featured in the Wall Street Journal, also featured in the New York Times and Scientific America. We indeed have the honor and privilege of being in conversation with a panel of members from RAD, and we are going to talk to them about what RAD is and also the achievements of RAD in the various countries, all the various chapters of RAD worldwide. So joining with me in conversation today, we have with us none other than Dr. Julie Patino. We also have with us Dr. Angelina Su, and also Doctor of Northwell Health. We have with us Dr. David Axelrod. I want to say welcome to our panel. Thank you so much for joining with us.
Thank you.
Thank you. For those who are hearing about RAD for the first time, as mentioned, it started in 2008 and it was actually founded by Danielle Malora, who actually had a promising career in the financial industry, actually a job with Goldman Sachs, and then suddenly just one day decided he wanted to contribute in terms of the medical field, and then that's where RAD was formed. So, in addition to what I've mentioned, just give us an idea about what was the whole essence of RAD and what it has been doing for countries worldwide.
So Dr. Muller started this program once he was a training radiologist, and recognized the discrepancy in care between what we have in the U.S. and what is available in developing countries. And the goal was to find a way to improve radiology services in developing countries to bring a better, improve healthcare overall. Since radiology is a very important part of any disease diagnosis and treatment. So that was the overall goal, is to focus on improving radiology services in developing countries.
Definitely, and since then, in 2008, actually RAD has spread in over 20 countries, and of course in countries where they're indeed in dire need of radiology services. And of course, since then, many people have actually contributed to this effort. And as mentioned, I believe you're also the director for the Latin American chapter as well. Actually, that include countries like Guatemala and several other places. Let's get a general idea as to some of the countries that RAD has actually reached.
So we have geographic regions of activity all over the world. I'm the director of the Latin American and Caribbean section.
Right.
We have programs in Guatemala, Nicaragua, Guyana, some work starting in Peru. We are working in Haiti. We have programs in Nepal and India and China and several countries in Africa. So all over the globe. All
right, so now I'm going to come to Dr. David Axelrod, actually. So being a doctor actually of Northwell Health, and of course, radiology is something, as described by Dr. Malora, sometimes people take it for granted, things that we take for granted here in North America, but it was actually needed in countries like Guatemala, Haiti, and also in India as well. When it's actually, as basically listed in the article, at least about 4 billion people around the world, they actually experience, basically a decline in their health, or sometimes it leads to death because it cannot be detected due to the lack of radiology services in those countries. In India and also in places like Haiti, after bringing forth this program, what are some of the illnesses actually that has been detected, and how has RAD actually made a difference in those countries?
So one of the early examples was breast cancer detection in India, and RAD in association with the industry created basically a women's health mobile unit to get out into the communities that really don't have easy access to major centers to provide these services and really detect breast cancer early, and mammography being one of the radiological modalities that has been proven to save lives.
And as described by Dr. Malora, that in terms of global health, people felt that radiology may not have had much to offer, but in terms of like places in Guyana, such as rural villages, how has radiology made the difference? And of course, how has reception been for people in Guyana?
Well, this program, starting a radiology residency program, will be a major impact in our health system since we have very little radiology support in our country. We have physicians from all departments that they do procedures blindly without any imaging facilities. So having this residency program start in Guyana, we won't just help, we'll help our population, we'll help our physicians and all the department be better at managing and diagnosing our patients,
Right.
and have better outcomes for our patients.
Definitely. Now, in places such as like Guyana and also such as like Haiti as well, I mean, as mentioned, that, and also as mentioned like by Dr. Malora, that worldwide, many people felt that radiology at that time may not have had an impact worldwide. But when we see that actually it is essential to be traced an illness or so here in North America, why do you think that in terms of global health, it was not really many people felt that it doesn't have a relevance actually?
So this change was very much based on the evolution of technology. So previously CT scanners, MRI scanners, ultrasound units even were so large that they could not, so large and so expensive and difficult to maintain that they really could not go backpacking into a rural area with a CT scanner strapped to their back. But now we have portable ultrasound units that are really even the size of your hand, with a probe that can be carried easily from place to place to perform point of care imaging diagnosis. So I think that is part of it. A lot of it also has to do with the presence of the internet and the availability of improved communications. So for example, one of the projects in Guyana is that we are putting a CT scanner in Bartica, which is inland,
Right.
And very difficult to get to. A lot of the accidents that occur in the gold mines go through Bartica,
Right.
and people need a CT scan to determine whether or not they need to proceed to a referral center. It is our hope that within the next year or so that the CT scanner will be available. The construction is there, the CT scanner is there. The images will be obtained in Bartica and then sent to the cloud, where our residents will download them in Georgetown and interpret them and determine the management needs.
Are we basically training, like in each one of these chapters, are we training doctors in India, in Guyana, also to carry radiology to like another level in these countries? Actually, I just want people to get the basic understanding of that.
Yeah, the goal of RAD is sustainability, and sustainability comes through education.
Right.
So the ultimate goal and the measure of success for this program is that in 3 to 5 years, when these residents are completed with their training, they will not need RAD aid. We will continue to support them in whatever way that they desire, but they will be fully trained radiologists, and they can build their own training program and continue their own training program, so that it's a sustainable thing. It doesn't rely on external resources.
Now, a question was put forward to me. In today's society, one of the growing epidemics, or one of the growing problems actually that people face in some of these countries, especially in India, is actually its late detection of autism. With the new advancements in terms of radiology and also with RAD, can this actually bring forth a revolution that you can detect like at an early age if a child is basically afflicted with autism and all these other illnesses like that?
You may be referring to functional MRI, which is even now just being brought into the clinical use. At the moment, we're working with more basic imaging technology to get a foundation for tests such as that in the future. But basic ultrasound, CAT scan, plain film skills are really needed first.
Okay, wonderful. As mentioned, so if someone basically wants to contribute and become a volunteer actually with RAD and they want to learn more and more about RAD and contribute in whatever way, how do they go about doing so? How does one join this effort of RAD?
So you can look us up on the web. radaid.org. You can also just Google RAD International, and there's a web page that describes our programs and has information about how to donate. You can also find contact information, like my email is on there. So that's certainly one way to start.
What was the awareness? I mean, how many people did people really see an importance in terms of radiology in Guyana, do you think? Or are they understanding the importance of it now?
Yes, they did, because some patients that could have afforded had to travel overseas to have
Right.
imaging done. And it's not something that the population can afford, or they need to go to a private setting. In our public setting, there is no CT. This is going to be our very first CT scan in the public setting, and you know it's really amazing for us to have that available to us.
Now with some of these countries actually, and I must say I commend RAD for reaching out to the various countries such as Haiti, Guatemala, Guyana. Now what is actually the mission, what's the future for this organization? What other countries are we looking to basically touch in the near future?
So that is determined by our volunteers for the most part. So many of our volunteers are international volunteers. For example, the Guyana program started because a good friend of mine that I went to medical school and residency with, Dr. Samuel Court, is from Guyana, and I was telling him about a project in Nicaragua, and he said, "Why are you not looking at Guyana?" And at the same time, we were contacted by Dr. Zulfikar Bucks, who's the emergency department director at Georgetown Public Hospital, asking us to come down. So it really is determined just by the circumstances, people reaching out to us and saying that they would like us to come and work with them. The community that we're working with identifies the needs, we don't identify the needs, and that's what makes it successful.
Now, I was actually just not so long ago briefed, and I was actually informed that in many ways we would like to basically, as we inform the community about RAD, we would like the community to also contribute in basically raising the awareness for RAD. So how does one go about doing so? In what way can the community assist this team? You know what I mean? Because this is actually not only reaching out to people from Guyana and also in India, Haiti as well. So how do we basically, how does the community help RAD in its mission and its goal?
So there are a couple of ways. So one way would certainly be to people who are interested in volunteer, have a medical background, for example, a nurse, a CT technologist or an imaging technologist of any type, a person with a background in IT, even media specialists, business specialists, all kinds of different volunteers are needed to build a total program. We don't just rely on physicians. So there are 8,000 RAD volunteers, and they're made up of all different types of professionals. So people who would like to volunteer are certainly welcome to look at the RAD website. There's a volunteer sign-up area for that. So that's one way. And then also the Guyana residency training program will be an ongoing yearly program until the foreseeable future. And when the residents come to Queens to do their training, we appreciate any support and kind gestures towards welcoming our residents from the warm climate of Guyana to chilly New York.
Welcome back once again, friends, and we continue our conversation with members of RAD. As mentioned, that this is something bringing about a positive change for many countries all around the world, and as mentioned, that this is something bringing a positive change to people in Guyana. And earlier in the program, we were joined by members of the panel. We basically put forward a few questions to them. Joining with us now, we've just added a new member to the panel, actually, Dr. Lawrence Davis, actually the director of the training program here in North America, actually, and you worked with Dr. David Axelrod, and we are talking about actually the residency training program in which Dr. Angelina Sushi is one of the 4 members from Guyana that's actually being a part of this training and taking back this knowledge, this very great knowledge back to Guyana. But now, first of all, let's speak to you for a few moments. Now, how did this whole thing come about? How were you introduced to RAD, and what influenced you to be a part of this mission?
Well, actually, Dr. Axelrod gets all the credit. He formed the chapter. He was our contact first with RAD. And then once he made that contact, and we realized that we wanted to do 2 things. We wanted to have a global health elective for my own American residents in my own program, which we created. We got approval by what's called the Residency Review Committee
Right.
that approves away rotation. So that was done. That was the easy part. But then through RAD-AID, the Guyanese government wanted us to help them create their own residency program, which is a lot of work. There has to be an outline of what the program looks like, what the educational content would be, and working with RAD-AID and our department, we succeeded in doing that. The first part of that experience was the immersion process for the 5 Guyanese residents to come up to Northwell Health, North Shore University Hospital, Long Island Jewish Medical Center for 6 months. And they are now 3 months into it?
Yes.
Right. So they're about halfway through. And we have the residents rotate through various parts of the department alongside with my own department's residents. And it's been wonderfully successful.
Talking about the residency program, and as mentioned actually by Dr. Davids, actually, so it's about 3 months that yourself and 4 others have been a part of the residency here, in the residency program here. How would you describe the training actually overall?
The training has been wonderful. Since myself and my 4 other colleagues have gotten here, we've been exposed to what a radiology department should look like. So we have that idea and sense of what a department should be, and we're hoping to take this back to our country. It mightn't be specifically the same way, but we'll structure it in such a way that it will work for us. We've been here and we've been given the opportunity to work with very brilliant attendings. They share their knowledge with us. We see many pathologies. We've learned so much since we've been here. We've been exposed to so much technology since we've been here. And it's been a great opportunity to start our residency program here. Since our department has not been up and functioning the way it should be as yet, we get exposed to all this technology and knowledge, and we have our physicians the attendings here to help us along the way.
As mentioned, and we see that this program has gone to India, and it's been recognized in India. But prior to RAD-AID, as mentioned by Dr. Malora in the article, that in terms of global health, many people didn't feel that radiology can contribute to much. Now, with India having so many doctors here, why do you think that India probably didn't really understand the importance or the essence of having radiology in India?
Well, I thought that there was a lot of radiology in India.
Right.
And there are a lot of physicians, radiologists who are from India already working in the
Correct.
States.
Yes.
And bringing that knowledge back to India, I thought would be a very high priority for them.
Right.
But it was my understanding there is a lot of radiology being done in India, especially in the bigger cities.
Okay. Understanding the importance of radiology worldwide, actually, in places such as Haiti and also Ethiopia, and also all these other places as well. Where do we see that in terms of like RAD-AID going to all these countries? What is actually the future for these countries after the RAD-AID experience there?
Well, if the Guyanese experience is a mark for what other countries' experience will be,
Right.
it will start slow. It will definitely be slow until enough people are trained in their own country to make a difference. Right? But that will take some time.
Now, so my next question that I would like to pose forward to you, with the residency program actually growing and more, with the 5 members from Guyana, what can we say to members actually of the Guyanese community that have family back home and then they're studying to become doctors? I think I put forward this question to Dr. Angelina Sue, but to join RAD-AID and also to come here to get that experience and then take it back to Guyana. What do we say to encourage them to be a part of the radiology department?
The first thing I want to do is thank the Guyanese community who have really embraced this. Queens has a very large Guyanese community. It's one of the largest communities outside of Guyana itself, and they really have embraced this process and have been very helpful, kind of embraced the residents who have come. And the same thing, what I really would like to also thank is my own department. There was an outpouring of love and donations when the 5 residents first got here. For instance, they came into chilly November without any winter clothes, right? They had nothing. like that. So the members of this department and the health system went out of their way to embrace them, donate things to them, give them things, books, clothes, stuff for the apartment where they're living. It was really a wonderful outpouring of love and respect for them.
So now, as mentioned, as you said, we were just scratching the surface in Guyana. It's in its infancy state. What's the next step forward, actually? So we take it out of the infancy state and we move forward. What's the next step forward?
Okay, so this is going to be an ongoing relationship that we have. We anticipate each additional class coming up and spending the first 6 months with us. I will continue to send my residents down to Guyana, so it is a two-way street, which is really very unique. This is the first radiology program that has this sort of relationship with global health. Not only sending residents down to a country, but having their residents come up and do an immersion in the United States. It is the only radiology program in the United States doing that. It's also the only program in Northwell Health that has that reciprocal relationship. So it's the beginning, all right? So we'll have 5 years of residence, and then the hope, of course, as Angelina said, was to have it self-sustaining, that they will be the leaders of radiology in their home country, and they will be the new instructors for ongoing generations.
Okay. Well, I want to say thank you once again. Actually, a special thank you to you, Dr. Davis,
My
for joining
pleasure.
the panel,
Yeah.
actually. And of course, it was indeed a great conversation with everyone. And of course, now, as mentioned, that RAD is actually the link to healthcare as described. And we do hope that with this information and with people's participation, that it could be a strong link to a sound and, of course, and even a great efficient healthcare and health system in all the places, especially Guyana, which, as mentioned time after time again, we are actually in dire need of it with the residency program, with such as members like Dr. Angelina Sue and the 4 others. We actually see a bright future in terms of that strong link in terms of healthcare. Thank you so much, and
Thank
thank
you.
you for being a part of our program.
Thank you.